Packing and orientation of hollow surgical instruments in the autoclave is important for the success of sterilization. Here we discuss about the packing materials and the orientation of phaco handpiece in the sterilizer. Packing can be done with three different types of materials, namely lint-free woven linen or the non-woven paper. One can use the envelope technique of wrapping for smaller loads or the box technique of wrapping for larger loads. Plastic paper pouches made up of medical grade paper and multi-layered casted propylene can be also used. Instrument can be placed unwrapped only in immediate use steam sterilizer or otherwise known as the flash sterilization, and these instruments should be used immediately. This form of sterilization is used only for instruments that become unsterile during surgery or to sterilize instruments in between the surgical procedure. The immediate use steam sterilization should not be used as a regular method to sterilize surgical instruments. While using the paper plastic pouches, care should be taken to ensure that the paper and the plastic ends face each other. Wrapped instruments should also never be placed in metal containers, as the steam has another barrier to penetrate and thus reducing the effectiveness of steam sterilization. This is a schematic diagram showing the internal lumen of the phaco probe, which measures only 0.5 millimeters. Cleaning the phaco tubings to get rid of the moisture is usually difficult and time consuming. The use of filtered and pressurized medical grade air by a compressor and a filtered by nanofilters with the use of a high flow air gun can help to get rid of the moisture in the tubings immediately. Various studies have proved that the temperature inside the lumen of the phaco probes reaches sterilization standards only when the phaco probes are vertically oriented inside the autoclave rather than horizontally placed probes where the sterilization temperature were not reached. Hence, placing the phaco probes vertically inside the autoclave is crucial for effective and complete sterilization.